I'm Peter Blick. I'm a GP in Bournemouth, and I've been a GP since 1981, so I'm perhaps one of the older GPs in our GP community. This is the second in our series of to inform local people about what we're doing in the Clinical Services Review. Some of you might have been to our earlier meetings, and some of you might come to our initial meeting at the BIC. I'm not sure how many of you, how up to speed you are with how the review is going. But there's an opportunity, more than half of this meeting will be, almost half of the meeting will be laid aside for questions. And it's important that you make notes during the presentations, and so when it comes to the question time, we can answer your questions. Just to look at our agenda for this evening, we've got speakers talking about the case for change. We've got a presentation about how we're engaging the public. And then after we've had 5 minutes break, we're going to look about what looks good and what are the next steps in the review. And then we're going to have this fairly lengthy question and answer session. And then finally have Simon Watkins, a GP colleague, is going to sum up and explain what the next steps are. So if we go on to the next slide, why are we doing a clinical service review? We're doing it to be safe, high quality and sustainable. We've got changing needs in our population. We'll talk about a bit later about how our age of our population is changing, how their medical needs are changing, and we need to have the best possible standards of care to fit for the future of our populations in the resources available. And when we say sustainable, we're not talking just about money, we're talking about workforce planning for the future of the health service. We want to do this proactively to provide the best possible care for you in Dorset. We want this to be, we're leading this with talking to our local clinicians, doctors and nurses, but we also want input from you, the public and the patients. And we want input from you all through this process. We're very keen to get the feedback, and we see these meetings as absolutely essential in holding the review. So this is really important to us. This is about your care, your health services. It's not about the staff, it's not about staff in the health service, it's about patients, and we want to be led by what patients need and what you think are the priorities. This is incredibly important to us. So I'm going to pass on to Phil, who's going to just say a few words about how the review is being delivered in the next 6 months.
Thanks, Peter. Good evening, everybody. I'm Phil Richardson. I'm the Director of Transformation for the NHS in Dorset. And in my role, I'm specifically responsible as the Director for the Clinical Services Review, so everything that we're talking about this evening. Peter started to outline already what some of the challenges are around the changing population and the quality of care and the funding for a sustainable service going forward. So what I wanted to start with is to share with you what the process is that we're going through at a high level, and then quickly go into the evidence that we've gathered to date to share with you what the need for Dorset is and why we need to change. And I'm going to spend some time sharing with you the details. So in the room, you'll be able to see right across Dorset what currently happens with services, what currently happens with care, and what happens in different parts of the Dorset landscape. Okay, so the programme itself is split up into 3 big parts and a decision. The first part is the review. So what we're doing right now is we're looking at what is the situation in Dorset, what does it look like in terms of services, what's available, what do we have in terms of funding, what do we have in terms of workforce, what's the experience with GPs, what's the experience in hospital, what's the experience in the community. We're looking at all of that information and we're pulling it together, and I'm sharing with you what we've got so far, the findings that we have today. So that's the first part. So that's the purple box on the left-hand side. The green box, does it come across as green? The green box is, once we have the information and we've looked at what the future possible options are for Dorset, we're going to share those with you. So at this point, we'll be sharing with you what we've found in terms of the current situation and what we believe are the possible options going forward. So we won't have decided anything at this point, and it'll be absolutely open to what do you think? And we'll go through a formal consultation process with you to get your views on what you want for the health services for Dorset. And we're taking a time frame of approximately 10 years. So it's from this point going forward. What do you think out of what is possible to do? Would you want, what would your preferences be? What's important to you? What would you rather we spent more time on or more effort on? So we'll go through that process. We'll gather that back, and then we'll make a decision based on your feedback and what the clinician's view is to say, what does that look like for Dorset going forward? And that will shape our decision making to say, right, this is now what we think that now needs to be done, having considered what is possible, what the viewpoint is, what the clinical position is, and that will shape the final point, so that's the lozenge shape in the middle, and then the yellow part on the right-hand side is then the implementation of what are these changes, and that will be phased. We've currently got on our plan over the initially 2 years, but it'll depend what the service is, and it depends where the improvements need to be made. That some may take longer, so it's just an approximate timing. So this part of the work takes us up to just past the election, and then past the election we will then be coming out to public consultation over the summer. At the end of that, which will be sort of autumn time, we'll then get back together, pull all that together and say, what's that now telling us? And then that will shape what the plan is going forward. So that's the process. So we're doing a formal consultation, which is saying, these are our findings, what do you think? And then we're doing engagement now, which is sharing with you exactly what we have at this point in time. So this is very much an ongoing discussion of this is where we've got to. So if any of you this evening are thinking, what's the answer? I can honestly say we do not know. Because we're at the point which is saying, understanding what we have today, we don't yet have what the possible options could be, and we haven't asked you what you think. So we can't do any of that until we've asked you what you think, and we can't do that yet because we're not ready to share with you all the information that we've gathered because we haven't finished doing it. So the purpose of these events is to give you almost a snapshot of where things are at a point in time, and we've done it at the end of last year. We're doing it at the start of this year, and we'll do it again before we get to the election to say this is where we are, and this is what it looks like today. What I want to do now is share with you the case for change. So this is the actual information that we have gathered. And just to set the context of what that looks like, we've gathered all of the information that we have as a commissioning group. So that's the performance around all the services that are delivered in Dorset. It's around the outcomes for patients. It's what happens in all the hospitals. It's what happens on all the community hospitals. It's what happens with all of the GPs. We've gathered all of that health service data, and we've also gathered a huge amount of data from interactions that we've had with you, such as the Big Ask. So the Big Ask had 6,000 people from Dorset feeding back on what they thought they wanted from the health service and what they wanted from services, and comments about what the population think about GPs, about hospitals, how they're treated, what works, what doesn't work, what they actually want, what they want locally, what you're prepared to have to travel further for. So we have all of that. We've captured all of that information, and what I'm sharing with you tonight in this presentation is in a need for change document, which is available. We'll give you the link to the end so you can download it. There are some copies available which we've put around into libraries and GP practices, but we can talk about paper-based. And for those who need easy read version or an audio version, we have versions of those available too. So the case for change, what I'm sharing with you is publicly available clinical performance and patient-based information that we've that we've gathered. We've spent the last couple of months, so just before Christmas, pulling this together, and I'm sharing with you the current situation. And the document that we've pulled together looks like this, and there are 7 pages in, and it's detailed information. So we haven't glossed over and just given you sort of high level. We've actually given you the detailed data, and sitting behind that, there's another 130 so pieces of data set in the pack you can also download from the website. So let's have a look at the population. So at the moment, the population in Dorset is going to increase over the next 10 years by 6%, and that's slightly higher than the national average. If you have a look at patients who are people who are 75 plus, it's going to increase by 30%. So the population dynamic is such in Dorset. There are approximately going to be somewhere between 50 and 80,000 more people in Dorset in 10 years than there currently are now. And of that growth, lots of it will come from an older population. And what our information showing is the older population have more complex conditions such as diabetes and heart problems. So in terms of the pressure on the service, we're actually going to have more people with more complex conditions. And I guess I don't suppose any of that's a surprise to you. But what it does show is that we've got this increase in population for Dorset particularly is higher than what's happening in other parts of the country. So if you have a look at that in terms of the what it means and specifically is that 1 in 10 people will have diabetes and 1 in 8 people will have coronary heart disease. So if we now have a look at the size of the population, which will be about 800,000 people in Dorset, that's a huge number of people with coronary heart disease and a huge number of people with diabetes. And in lots of cases, it's a combination of the two. So we have an increasing pressure in terms of specifically our aging population. But if you then step back from that and say, what does that population actually want? The demands that we've had through the questions that we've asked, and there is a demand for better access to GPs outside the current system. So longer working time for access to practices. There is better care to home, better care closer to home. Can I get something in the home? There's a bit around having specialist centres where we can go to for something specific. So there are a number of things in terms of the patient need, which if you add that into the increasing population, you start to get an idea of what some of the pressures are going to be that are going to face us. If you then have a look at what actually happens, there is a massive difference between different GP practices about how many people go to A&E. So I'm sure you're all well aware of the pressure we're currently under in Poole and in Bournemouth and also in Dorchester in terms of A&E pressures. But there's a variation between what happens depending on which GP practice you come from. So if you take the numbers and you create a 1,000 patient equivalent, in some practice 173 people in 1,000 go to A&E. In other practices 459 people go to A&E. So everything else being equal, we've got some quite wide variation between what happens in different GP practices. And what that means is, for some of the practices where perhaps have more coming into A&E, you start to look at some of the other data which shows that actually in A&E there's quite a few people end up in A&E who don't need to be there. And there are lots of good reasons why they currently are there, but that's what we need to address. We need to address why are they there in the first place. And some of you may have experienced people who you know in your friends or family who said, well, I got sent to A&E because there was nothing else available to me, and I got there and waited a really long time to be told, actually, I just had to go home and see my GP. And you may have heard stories like that or experienced yourself. Then if you have a look at really important topics, which are such as mental health, there are some quite big challenges in terms of providing the right kind of care and support at home. So we have a structure which is GPs and then community support and then hospitals, and then there's a link that we have with social care. But actually as a patient or as a family group that needs support, that needs to be all wrapped together. So that we actually have, if you come out of hospital having had your urgent medical treatment, but you have challenges around mental health, we need to be able to package that together so you get cared for as a whole. Not sent to all sorts of different places to get different things. It doesn't make sense. And all of those pressures create additional pressure in the system, so the system itself isn't currently working, and mental health is one of the challenges that will sit as well with an ageing and growing population. If you have a look at A&E specifically, so this data, we pulled this data together before the information that you've seen in the press in the last couple of weeks, but there's a 22% increase in A&E admissions and a 30% increase in those that are subsequently then hospitalised. So they're two other massive pressures, but the hospitals themselves haven't increased in size, and some of the direct result, you've seen that in the press today. If you start to look at, so if we move away, let's talk about happy things for a moment, and we'll talk about babies, because that is a happy thing, isn't it? If you have a look across Dorset at the different hospitals, we've got very different maternity setups between what we have in Poole, what we have in Bournemouth, and what we have in Dorchester. And in those three different areas, if you have a look at where there is a challenging birth, what you need is a consultant obstetrician on call. You need them actually in the hospital available to treat, to work with the mum if there is a challenge. But at the moment, what the data I've got here shows is a variation between our hospitals between 24% and 36%. So in some of our hospital service, we've only got a consultant available for 24% of the time. Now, you were all babies once. And I can't believe you all turned up between 9 and 5 when there was a consultant on the ward. So that's not wrong. That's clearly wrong, isn't it? That's clearly wrong. And but we've got a fantastic service, but it's in some cases like that, it's not in the right place at the right time. So we need to fix that. Travel in Dorset is not easy, is it? And we've actually got, if you go right across to West Dorset, 25% of the population don't have a public service that will get them currently to one of our acute hospitals. That's a massive reliance on somebody else, isn't there, or somebody having a car. We've actually in Dorset got one of the higher car ownerships. Did most of you drive here tonight? So that is that's one of the other challenges. And of course, as you know, in the holiday season, then the whole thing just grinds to a complete halt. And some of those things become difficult. So how do we address in the infrastructure that exists around us? How do we make that work so it works for all of us? So we've looked at travel, and then the other bit I've talked about is working better with social care. One of the challenges, if we just think about us collectively as being Dorset, one of the challenges we have is that there aren't enough residential and care homes. There just physically aren't enough. And then we've got the challenges of domiciliary care, is that care at home, which is what we've been told people want, is that we don't have the services connected together which allow that to work effectively. And then where we do have it, we don't have the information. So if we have somebody cared at home and they need a chiropodist to go in, which is not unreasonable, the chiropodist doesn't necessarily have access to all of the medical data that would help them understand what the patient is. So we all spend all our time repeating what we've just said to the person before, and that doesn't help either. So those things just don't connect. But the piece about social care and what we do with local authorities, we need to make sure that interface works much better together, and that's one of the challenges that we're working through. How can we do that? We've also got some challenges around staffing. So if like babies, if I flip it actually then to medical emergencies, so A&E, what you need to be able to cover A&E for 24 hours a day to have consultant support is you need in the hospital 10 qualified A&E consultants. And that allows you to have somebody qualified available all the time for whatever incident comes in at the time. But at the moment, we've got a range in the 3 key hospitals, none of which have full consulting cover. So they can't physically provide a consultant to cover the full 24-hour spectrum. And that has a knock-on effect, because then it takes longer to get services done, and some decisions get delayed slightly while we try and get the consultant to be available to solve that problem. So we don't have a full cover for 24/7. And as you know, A&E is not a 9 to 5. It's not a 9 to 5 challenge. And the 10 consulting cover is there is a Royal College of Emergency Medicine, and that's their recommendation. So we're also not really hitting some of the recommendations from some of the medical bodies that set what the standards of quality should be for care. And we've got instances that in other places, such as stroke. There's a lot of evidence to say that if you have a stroke, if you get a scan within an hour, it improves the opportunities for recovery much better. So if you can get a brain scan within an hour. At the moment, Dorset falls below the national average for that, as a whole. So we don't get, for stroke care, we're not even at the average for the UK. On top of that, there is a clinical standard which says actually there's a much better way of doing that, and because of how we're currently structured, doesn't allow us to do that. But we can do that. Now we have this data, we can start to say what are the services that need to change to make that work. So the point was that there are challenges in recruiting A&E consultants in this case in Dorset, and if we have a look, if I take the 10 number, which is the Royal College standard, we currently don't have enough people in the recruitment pipeline to allow us to deliver that number as it stands today. But I think the workforce, well, let me just pick up, and thank you for that. Let me pick up on the workforce generally. We have workforce challenges right across the patch. Recruiting qualified medical staff is a real challenge. And because of that, we have imbalances in different parts of the county, which means that at some places we're using agency staff which are much more expensive to fill some of those gaps. And that's a more expensive way of solving the problem. So there's a much better solution to do with workforce than we currently have. Before I want to share with you some of the numbers now, just to give you a shape of what, because funding will be a question I thought you would have. But the piece I just want to bring back to the overall process for this review is it's been completely led by clinicians. So we have approximately 150 GPs, medical directors from hospitals, ambulance paramedics and GPs, community midwives, community nurses, pharmacists, a wide range of health professionals who are meeting to say, if there are 750,000 people in Dorset, with the clinical evidence that we've got today, of which I've given you a summary, we know for the next 10 years what the right clinical models of care, what should we do for maternity, what should we do for emergency, what should we do for surgery, what should we do for mental health, what should we do for children. They're pulling together, and that's the work we're doing right now, they're pulling together what the models of care are. And then once we've got those models of care, we're going to look at how we can make those models of care work together, so that from Dorset, instead of saying, what have we got now and where is it, we're saying, what's the right thing to do for that population? And then we're going to look at how we then manage that across Dorset to make sure we deliver that integrated package of care. But all of this is being led by clinicians, and what I'm doing and what my team are doing is supporting, so Simon and Peter are both key members of this. There may be some members of the audience who are part of the wider clinical group. So in Poole Hospital, the Poole Hospital people are involved absolutely in thinking, what does this look like? So we're engaging the clinical workforce effectively across Dorset, and that's what's coming up with, this is what we think the right thing to Dorset is, do for Dorset. If we have a look at the other piece of the puzzle, it is, well, what can we afford? So the health budget isn't going to radically change. And if we have a look at the moment on how we do things, and we look forward for 10 years, we forecast there's going to be a £167 million gap between what it costs us to do and what we need to do. So part of the work we're doing is to say, how can we best manage that money to give a higher quality of care, which Peter talked about, to be able to give it to all the population of Dorset, wherever you live, and to be able to give it the way you would like to get it. If I just close at this point with saying we're starting with the patient. We're saying, what does the clinical view say that patient will need over the next 10-year period? And then we're saying, what spend have we got? And then how can we move that around so that we can balance it properly right across Dorset? That's the piece of work we're doing. And it's not been done before, and it's certainly not been done in Dorset. And it's been done in pieces around the UK, but it's only been done in pieces where they've got a financial problem. And in Dorset, we don't have that yet. So what we're actually doing is be able to take a sensible approach to say, we can see what the future's looking like. We can see what our population's looking like. We know the challenges that they're going to have. We know the services that they're going to need. And we need now to get our services right together so we can deliver those sustainably. So that's how the review all fits together. What I'm going to do is pass over to Frances now, who's going to take us through how you can get involved, stay involved, ask the questions, how you can get access deep into the heart of everything that's going on. So she's going to share some of those things with you, and then after that we'll just take that 5-minute break that Peter talked about. Thank you very much.
Thank you. Lovely. I'm not that tall, I have to go on my tippy toe. I'm going to hold it.
Sorry.
That's all right, no problem at all. I'm delighted to see so many people here tonight. I was actually going to start off, when I arrived here it was sunny, and I was going to say thank you so much for coming out on such a lovely evening, but actually I think we're probably all in the best place, inside the warm, in this lovely hotel. So thank you all for coming. I'm really, really grateful to see so many people here. My name is Frances Avis, and I'm one of the engagement leads for NHS Dorset Clinical Commissioning Group. What I wanted to do before I actually tell you what people have been telling us so far and what we've done in response to that, as that lady said in the third row, very important to make sure that when we get views, we make sure we feed back what we've done and what we haven't done, absolutely, across the whole process. So thank you for that. What I wanted to do is just touch upon the engagement process across the review before I do tell you about December and what we've done so far. So engagement, or participation as it's often called nowadays, is made up of many different elements. So there's view seeking, and there's listening, and there's responding, and there's feedback, there's information giving, there's communication, and there's consultation, amongst others. All of those elements are really, really important, and all of them have a different role to play at different times in the journey. And I think that's really important to recognise. So if we look at the review process, as Phil told you earlier, there's 3 key stages to the review, with the review with design stage, following by the public consultation in the summer, and then implementation, which will carry on. Engagement, participation is important across all of those, but also quite very importantly, there's actually a stage that preceded those, and we've actually been talking to you as a CCG, and before that as primary care trusts, for many, many years. And we've been gathering data from you about what you think about services, what you think about certain conditions, certain locations, and so forth. And it was very important at the start of this process to give that due consideration. So what we did was we gathered from ourselves, from the hospital trusts, from Health Watch, from SWAST, South West Ambulance, from our local authority colleagues, from Dorset Healthcare, the data that they'd gathered, and pulled that all together in a spreadsheet which we shared with the clinicians. In addition to that, very importantly, as Phil mentioned earlier, we had a number of Dorset-wide surveys that have been done over the last few years, and we had 29,000 qualitative pieces of feedback that we wanted to feed in. So we've actually worked with Bournemouth University, who analysed that for us in October, and they themed it. And I suspect if I gave you a blank piece of paper and said to you now, what do you think the needs are, it would come out with the same themes that they found for us. All of those things are fed into the Case for Change data, and they're things like improved access in terms of time, improved access in terms of location, better information, better continuity, care closer to home where possible, happy to travel for where we need specialist services, and so on. So all of that was really important data and important for us to check. And that's all fed into the beginning stages of this work, which I think is really, really important to acknowledge. information and communication, as you can see here, goes right across the top. And for me, that's vitally important. It's really important that we have an ongoing dialogue from before the review started, as we did have, through this review stage, right the way through the public consultation and through implementation. Because if you're not, what we want to do is, by the time we get to consultation, for the whole of the population of Dorset, if possible, 776,000 people, to feel informed about what we're doing and why, and to be with us on that journey. So when it comes to consultation, you're all ready to play an active part, and it can be a real meaningful discussion at that stage across the summer. Then in terms of the implementation phase, patient, public, carer engagement will be absolutely vital to any changes that are agreed, and we'll be working with local people across that stage, however long that is, into the future. So this really is just the beginning. Okay, so to share with you what you said in December, as Phil said, in December we had a series of 3 public events, and we shared some of the clinical data that the clinicians had seen. A huge piece of feedback from people that we showed said that actually, thank you for showing us that, and thank you for showing us what the clinicians have seen and are taking into consideration. But actually, it's hugely complicated, it's hugely technical, and what we need as a public is a public-facing, plain English narrative explaining what you're doing and why. So we've worked hard right over Christmas. We did have Christmas Day off, but we have worked hard to produce that for you within that month. So you will get copies of that today, and it's going to be widely available. It's also, very importantly, that narrative of what we're doing and why, and the case for change, is also available in easy read format. Bournemouth People First are translating that for us at the moment, and we'll be sending that out to people with cognitive difficulties. And also in audio version as well. So, and importantly, it is available in other languages, or we will make it available in other languages on request. So thank you for that feedback, and we've responded to it. Secondly, a strong piece of feedback was that we needed to give due consideration to the role of informal carers and the voluntary sector. And people felt that that was missing from some of the data that they saw. That's absolutely considered as vital, and it has been included within the technical case for change. In addition, many of you might have heard of the Better Together programme, about health and social care working much more closely together. That programme is continuing alongside the clinical services review, and very importantly, we're working closely with them, directly linked in with them, and they have their own carers programme, so that's acknowledging the importance as well. We also have carers representation on our patient and public engagement group. Now, those of you that came to the launch will probably heard about us launching that group. Delighted to tell you it's up and running. It's absolutely fantastic group of individuals. It's not about putting people in boxes. We desperately didn't want to have people from, for example, the same housing estate and the same diversity and so forth. So what we have got is a group of about 25 individuals from Dorset with a rich life experience across Dorset's geography, Dorset's demography, and Dorset's diversity, all of the protected characteristics, so that we can have rich conversations at each stage of the clinical services review and feed that information directly back into the process. That's actually being chaired by a national patient leader, Anya de Jong, who some of you might know, who's absolutely passionate, as I am, about making sure that the patient carer public voice is heard, listened to, and responded to. And she's also sitting on the assurance group to make sure that that happens. So, and to date, she's delighted, and it's my task, obviously, to make sure that that continues. As I say, we've got carer representation on that. We've also got an engagement leads forum. So I'm linking in with the engagement leads like myself across health and social care, again, Health Watch, again, South West Ambulance, all the hospitals and so forth. And we're coming together to share good practice and to share the work that we're doing as widely as we can, to give opportunity for involvement, information, etc., as widely as we can. And we've also got all 3 of the voluntary organisations, so Dorset Community Action, Bournemouth Council for Voluntary Services, and Poole Council for Voluntary Services are all sitting on that group as well. So we're working very closely with them to acknowledge their needs as well. It was also raised when people looked at the data in December that physical and mental health services should be considered together holistically. Again, it's recognised that that's vitally important. In fact, when the clinical working groups were set up, it was decided that rather than having mental health as a separate group, what we should do is have mental health representation in each of those groups, which has happened because it's so important to look at care holistically. There was some concern expressed on the boards, on the information that I gathered and collated, that some areas weren't included. It's really important to stress that the data that was shown was the evidence for why things need to change and not an audit of all healthcare in Dorset. How particular services are delivered at the implementation stage, so how services, for example, for children and young people, for minority groups, for different conditions, etc., that will all be explored in the implementation phase that I touched upon earlier, and patient-public engagement will be absolutely key to that process. In addition to that, it's really important to recognise that when we're having public meetings, people will want to share with us their personal experiences. They will want to raise issues if they feel they're not being considered. So what we're doing at each public meeting is recording everything that's said, and I'm actually putting that into a spreadsheet so that when we get to implementation, we can actually filter those comments and make sure that we give every comment to do with every different condition, every group, every area in Dorset due consideration at that time as well. And we're feeding that information back to the clinical working groups as well. So everything that you say is valued and it will be stored and considered at the appropriate time. And we'll let you know how it's been considered. So, consider staff resources. Well, Phil talked about to you the importance of considering workforce and staff planning, and absolutely, as you can see, it's an integral part of the whole process. It has to be. And then finally, as I touched on before, we also had an additional number of comments. We had 293 pieces of feedback just in December at the events. All of those have been themed, as I said before, fed back to the clinical working groups and being stored for further consideration. So the conversation continues. Please stay involved. We'll let you know later about the next series of events. I'm around and I'm going to take part in the panel discussion. So if you have any questions at all, please don't hesitate to ask. Okay, thank you very much.